Well, joint pain has a lot of different causes, and it really does depend on age, injury, kind of how long it's been present, those sorts of things. Some of the main causes for joint pain really are arthritis, first and foremost, whether it be wear and tear type arthritis or some of the other arthritises such as rheumatoid and the autoimmune diseases. Other problems can occur from tendonitis around a joint, bursitis around a joint, tears of either the labrum in the hip, meniscal tears in the knee, rotator cuff tears in the shoulder. There's a multitude of different things. And then sometimes it's not even related to the joint. Sometimes there's other injuries, including back injuries that can refer pain to joints. Sometimes it's even hernia injuries that have nothing to do with the joint that really kind of manifest themselves in the joint. So there's a lot of different reasons for joint pain, and it really depends on the age group and really when it started and how it started. So what I see most often in the office is osteoarthritis. It's the wear and tear arthritis of the joint. As cartilage wears down, we start to lose it and you start to wear onto the bone essentially. So when that starts to happen, it becomes very painful. The joints get stiffer, you lose range of motion, you lose strength, the joint becomes inflamed and irritated, and it can really start to affect a patient's life and everything they do. So essentially what's happening with osteoarthritis, on the ends of all of your bones, especially at a joint, there's a covering called cartilage. Cartilage really is the bearing surface and allows the joint to function appropriately. As that wears away, it gets thinner, pieces start to fleck away, and then eventually it wears down to the level of the bone. The bone is not a good bearing surface. It hurts when you start wearing there. And that's really where we see the need for a replacement, is when we get to that bone on bone. Our options really start to wear out. And that's when we want to start really looking at joint replacement surgery to get you back to those activities you want to do in a pain-free manner. So the second most common thing that I see in the office is really bursitis and tendonitis. And really those kind of go hand in hand. We have a lot of muscles and ligaments that cross joints. And when they cross a joint, they have to move. Wherever you have something that crosses bone or a joint, there is a bursa. And a bursa is there to protect that tendon or ligament from really rubbing on the bone. So sometimes we have changes in the way we walk, the way we move, that really affect the way the muscle, tendon, and ligament function. And whether that's from an injury or from arthritis, it can really be something that's kind of a nagging pain that really prevents someone from doing what they want to do. There's a lot of different treatment options for it, whether it be an injection, oral anti-inflammatory, sometimes we use oral steroids, physical therapy, and sometimes we just need to kind of work through it a little bit and it can kind of go away. So a lot of times bursitis and tendonitis are caused by repetitive activity, whether it be someone's work where they're doing the same thing over and over, or something in sports and activity that they do a lot. We see it especially in the younger population with tendonitis, see it in baseball, basketball, football. They're doing the same thing over and over a lot, and it really inflames those tendons. And really sometimes they just need a little bit of retraining to really stretch the tendons, really work on that pre and post activity kind of workout, so that really they're lessening their chance of an injury and a long-term problem. Another common cause for joint pain, especially around the hip and the knee, is either a labral tear in the hip or a meniscal tear in the knee or some other ligamentous injury. So now what is a labrum in the hip? So a labrum is really surrounding the joint, and what it helps is that hip to really conform. It's a ball and socket joint, and it seals off that joint so that that ball really forms to that socket. Sometimes we get little tears in there, and that can cause some irritation. Sometimes the tear can flip in and out of the joint and kind of cause some snapping, those sorts of things. And again, it really comes down to, usually it's an injury, sometimes it's the morphology or the shape of the hip that has been causing a repetitive injury over years. And there are things we can do to treat this. Ultimately, it's getting seen and getting the right thing done. We start with x-rays, sometimes we'll do some physical therapy, and then sometimes we get an MRI, and that's where we can really delineate what's going on in that hip. We see labral tears more often in the younger population. This is definitely a younger person's problem. But sometimes people have had long-standing labral tears, and it can develop into arthritis over time. In the knee, you can see some meniscal problems, and there's a lot of ligaments around the knee that can cause injury. We see these frequently in sports injuries. Sometimes it's just a degenerative tear. A lot of times there's an injury involved, and you can kind of remember or recall exactly what happened. Again, we try some of the easy stuff first, just kind of resting it and anti-inflammatories. If that's not working, again, it's getting in and getting seen so that we can really kind of prevent long-term damage to that joint. If it's something easy to fix, then we can go ahead and just take care of it. Sometimes there's more, but again, it's really kind of getting those studies done so it can really help us kind of move the treatment forward. As far as shoulders go, again, there's a lot of different mechanics that go on in the shoulder. So you can have things that include labral tears around the shoulder, which kind of works the same as the hip. Another thing that can go frequently wrong in the shoulder is rotator cuff injuries. This is kind of that middle-age injury. We see it a lot in workers, especially overhead activity stuff. A lot of times people will remember my shoulder started hurting 3 months ago and it's gotten worse and now I can't work overhead, I can't reach up, I'm having trouble sleeping at night. It's really kind of seeing what's going on. Again, we start with the x-ray and we can always get further studies from there. But it's a very common injury that we see. So injuries to joints really boil down to, what age the patient is. So early injuries are usually due to acute things such as sports injuries, activity-related things, and that's really what we look for in that age group. As you get into your teens, 20s, again, it's still those really acute injuries. Things happen, they remember when it happened. As you move further down, now you start to get into the chronic repetitive injuries, and in the older stages of life, you can get into those injuries that are long-term wear and tear type things on the joint. The key to really looking at your joint pain and any pain that really hurts you is that if it's really affecting you and it's not going away in a few days, you should get it looked at, especially if you're not able to walk on it or move it. These are things you really want to get checked out. When you really have a joint that is affecting what you do and you're telling yourself, I'm not going to go do this because it hurts, that's when you want to get things looked at. And that's when treatment options can really help things out for you and really change your life.